My name is Joseph Garza, and this is my Unit 2 assignment for Community Health Assessment for Purdue University Global. The assignment is circled around the website Living to 100. The website is made to give people a broad overview of their life expectancy based on a series of 40 questions and 4 subjects: personal, lifestyle, nutrition, and medical, to establish your current healthy or unhealthy habits. This slideshow is a brief synopsis of my results from this quiz and my take on how this knowledge can be used to better my community. My overall calculated age or life expectancy is 82 years old, with a potential lifespan of 98 years old. With my current age of 29 years old, that stands to be a fairly bright future. The only critique that the test had for me in this category was reducing the amount of hours that I work weekly to 40 or fewer hours, stating that it could add a half year to my lifespan. At the current moment, I do work well over 40 hours a week, with it being closer to 60 hours a week. However, this is due to me being in the military, and so this is something that will not likely change until the time comes that I leave active duty service. In this section, the result had 3 critiques for me in order to expand my lifespan: to cut down on my caffeine intake in order to add another half year to my lifespan. Because of the amount of time that I spend working on coursework and my large family, I do not get very much sleep throughout the night, and so caffeine has been my driving force. However, I'm not sure if I'm able to cut down at this moment. Half a year is great, but I feel like without some caffeine, it would probably be pretty miserable. The quiz here is recommending that I take 81 milligrams of aspirin each day in order to improve my heart and brain health, boasting it could add another year to my lifespan. At this present time, I already take Celebrex every day as an anti-inflammatory due to several joint problems such as my knees and back, and so I'm not sure if aspirin would be a better choice in its place, but I will leave that up to my orthopedic doctor to decide. To limit my exposure to ultraviolet rays, which would come from sunlight or tanning beds, to reduce my risk of skin cancer and add another year to my lifespan. I already don't get outside nearly as often as I would like to, due to my busy schedule and the fact that it keeps snowing, meaning my favorite hiking spots are snowed in. And limiting it any further would likely make me a hermit. I personally think that this taking a survey on your nutrition in December is a bad idea. But in this case, the quiz had 5 critiques for me. Getting my weight down so that I am no longer overweight and add another 5 years to my lifespan. At the moment, I'm 70 inches tall and 225 pounds. And so yes, I do agree that I should lose some weight. However, if I were to lose enough weight to be within the range that my height says I should be, I would be too small for my own liking. Taking fast food out of my diet to add another year to my lifespan. I agree that taking fast food out of my diet would be for the best, but it can be difficult when I'm on the go. Cut back on red meat consumption to 1 to 2 days per week to add 1 year to my lifespan. I do not think I can take red meats out of my diet any more than I already have. This is just something that has always been a large part of my diet. Cutting back on sweets to 1 to 2 times per week to add half a year to my lifespan. I certainly agree that I've been eating too much sweets, but this is December, and so that isn't likely to change until after Christmas, when my diet goes back to normal. Changing my overall daily diet intake to maintain a healthy weight and add 2 more years to my lifespan. At the moment, my diet has already been changed to a far more healthier one, and I'm sure that there is room for improvement. However, I have to go one step at a time. This part of the quiz asked me how well I handle my medical needs and had 3 critiques for me. Examining myself for cancer to add another year to my lifespan. My family does have a history of cancer on both sides with both my mom and my dad, and so this is very good advice. Remaining in touch with my healthcare provider yearly in order to add a half year to my lifespan. Being in the military, it is a requirement that I am seen by my primary care provider at least once a year, and so this part is already happening. Getting my blood sugar checked to add another year to my lifespan. I've honestly never thought to check my blood sugar, even though there is diabetes on both sides of my family. They are all type 2 diabetes, and so I never thought it was needed. This quiz does seem to be fairly insightful. However, I do think it limits itself in terms of its understanding of someone's health by only asking 40 questions. I can, however, see how it can be a very powerful tool for an impoverished community, as a quick and simple tool to help people with a more limited knowledge of health better understand their health needs. And that concludes the assignment.